For more on the COVID-19 crisis, let's bring in ABC News medical contributor and infectious disease specialist, Dr. Todd Ellerin. Doctor, good morning.
Good morning, Terry.
So the White House warning, this alarming warning, staggering 90,000 deaths in a month they're predicting. This is, we're seeing new variants continuing to spread, but the number of deaths and hospitalizations seems to be falling. So I think people are confused by this. What is it? Is there light at the end of the tunnel, or do we still have a long way to go?
Well, I think there's both, Terry. And you know, the issue is that, you know, there's a lot of virus out there. But as we're seeing the case counts come down and hospitalizations come down, you know, that is good news. But remember, we have contagious variants out there. We have a lot of winter left. People are indoors. So what we have to do, there's a marathon and there's a sprint. The marathon is vaccinating enough people to reach herd immunity. But the sprint is to get those numbers down. You see, if we don't get those numbers down with masking, physical distancing, then it's going to take us much longer to get to herd immunity. So there is a prevention light at the end of the tunnel, but we have to crush that virus first.
Well, let me follow up on that. These highly transmissible variants that we're seeing, especially the UK variant, which is here, and the one out of South Africa and Brazil, are you saying that the vaccines won't be able to keep up with that spread?
That's exactly what I'm saying. Because really, we're not going to reach herd immunity until the general population is vaccinated. You know that's not going to happen for many months. So what we have to do right now is the things that we know work. Universal masking, avoiding crowds, the distancing. That's what's important to get those numbers down. And the less virus there is in the communities, the less variants we'll find.
Got it. And the variants, of course, vary from what they call the wild strain, the original one. The Moderna now says it's working on a booster for its vaccine to combat the South African strain out of an abundance of caution. So how effective are that Moderna and the Pfizer vaccines that people are getting against these new variants we're seeing, do you think?
Well, the treadmill test is going on right now because there's lots of variants around the world and people are getting vaccinated. So we will know within time. In the lab, it looks like both vaccines are excellent against the UK variant. We just heard from Moderna that against the South African variant in the lab, there was a 6-fold less immune response, okay? So we'll still have to know how that works, okay? We'll know over time. But I'm still optimistic that the vaccine gives a broad, robust immune response. So hopefully they'll be very effective. The key right now is get vaccinated.
All right. And one more question. I think a lot of people have this question. Pregnant women who are maybe concerned about the vaccines, is it okay for them, do you think, to get the Pfizer or the Moderna vaccine that are out there?
So WHO just came out with a release today that basically said that they were advising against pregnant women receiving the vaccine unless they're in a high-risk group or a healthcare worker. I was really discouraged with that message. I think the WHO is an excellent messenger. I usually agree with them. But in this case, I like the CDC's approach, whereas we have to individualize it, risks first, benefits. And remember, you know, pregnant women are at higher risk of hospitalizations, respiratory failure. Most pregnant women and their neonates do very well. I want to make that clear. But they are at higher risk. So from my perspective right now, the benefits outweigh the risks. I'm recommending that my pregnant women do consider vaccination. But if they refuse or decline, that's important. We don't want to shame that. That's okay. They need to be able to make an individual decision.
On the best advice on a case-by-case basis. Dr. Todd Ellerin, as always, thanks very much.
Thanks, Terry.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.